We are live.
Good morning, folks. I'll call our meeting to order. This is the Social Services Committee for May 3rd. We have regrets this morning from Mayor Bailey, who can't be with us, and ongoing regrets from Mayor Davis, who continues to recuperate from his surgery a week ago. Let me ask if we have any declarations of conflicts of interest. I see no hands. I'm going to ask for a mover and seconder for everything that's going to be before us today. Moved by Councillor Bell, seconded by Councillor Oakley. Do we have separations today? Councillor Bell.
Yeah, thank you, Mr. Chair. I'd like to separate 6.1, please.
And Councillor Miller.
6.1 as well and 6.4.
And Councillor Samwell.
Mine was 6.4, so it's already separated now.
6.4. Okay, thank you. Okay,
I'll separate 6.2 and 6.3. Thank you.
anybody want 6.6? We'll go ahead and vote on 6.6 then. That was Councillor Carpenter. You separate 6.5? Did you?
No, I did not.
Okay, and 6 points. So 2 to go to the vote, Emma.
Thank you. Those items that we are voting on are 6.5 Sunrise Villa 2022 Annual Water System Report and 6.6 the Social Services Committee Minutes. All those in favor? Thank you. That item carried unanimously.
Vice Chair Bell, you have the floor.
Thank you, Mr. Chair. Item 6.1, the OW business plan. I thought it was a terrific document, but it spells out a very complex problem. And it also seems to spell out a problem that is becoming larger in scale. The issues are complex. The root causes, I think you've identified very clearly. And I would like to hear from staff if there's more we can do to, for example, put more people into employment. I was staggered by the statistic that an average one-bed apartment in Brantford is $1,165 a month, and yet the OW rates don't approach that, and it becomes more of a challenge further when you go into two-bedroom apartments. I just don't know how these folks manage, and I'd be interested to know practically how we can do more to help what is a growing number of people who are in a very difficult situation. I appreciate staff's comments.
So through the chair, so it's Anthony Labatt, acting director for the FIS department. Those are excellent comments. The issues are certainly complex, and I do think the report did highlight that. In terms of the struggles and the difficulties that you had mentioned, especially in terms of the cost of living, the social assistance rates have remained the same since 2018. And of course, you look at the cost of rent, the average cost of rent and rising inflation, it does make it very difficult for individuals to get by in terms of their basic needs and housing. In terms of what we could do more for the employment supports, I can tell you with the employment services transformation, the city no longer delivers the employment supports aspect of the Ontario Works program. However, we do work very closely with our Ontario Works providers, the system, with our Employment Ontario providers, with the system service manager who is FedCap. We've also brought a group together that includes Workforce Planning Board of Grand Erie, along again with the system service manager FedCap, to better understand the supports needed for the Ontario Work service users to gain and maintain employment. So there isn't a simple answer, or there isn't a simple solution. However, what is important is that we continue to raise these issues with our program supervisor, with the ministry, which we do on a monthly basis in terms of the Ontario Works rates and the supports that we feel are necessary. And also having a local response, looking at ways that we can adapt our services to better meet the needs of the service users. But again, there's no simple answer.
Thank you very much for that response. Do you have a sense of whether the number of clients is going to continue to increase beyond 2023, or can you see some mechanism that causes it to plateau?
Through the chair, it is predicted that the Ontario Works caseload for Brantford Brant will continue to increase into 2024. It is likely that the caseload will reach 2,300 cases, if not higher than that. Some of the contributing factors to that are as simple as the population growth for Brantford Brant. But when you actually look at the percentage of the individuals in Brantford Brant that access Ontario Works supports, it's 1.4%. And when you look at the provincial average, it's actually 1.5%.
If I can, to Councillor Bell's question as well. Councillor Bell and Acting Director Labatt has answered very well, but just in addition, I think what you're asking is the report highlights 4 basically crises: a drug crisis, a mental health crisis, a housing crisis, which all lead to employment. You look at Maslow's hierarchy of needs, back to Psychology 101, there's 3 things you need. You need proper housing, you need proper food, and you need proper supports. And right now, all those 3 things are failing right now in our society. So it's difficult. I mean, the province gave us, in the next report, you'll see, next couple of reports, you'll see the province is giving us some more money. But it's a situation where we're accountable what's going on the streets and what's going on in our community, but we're not responsible. There's a lot of other agencies delivering mental health supports, delivering addiction supports, things like that we're not responsible for, that we don't have oversight for. The province does, or some other funding mechanism. So we're, as Anthony said, we're trying to piece those people together to try to find a wraparound system for many of these individuals, to try to find them employment and try to find them adequate housing and food.
Thank you.
Thank you, Councillor Time. Councillor Carpenter, you have
Did I hear you correctly? There hasn't been an increase in OW since 2018, 5 years,
Yes, that's correct.
the full length of time this provincial government's been in power. Okay, so this report, excellent report, as I would agree with Councillor Bell. This is a long, I put this in my document file. Where is this report shared with, and how many agencies is this report shared to?
The report itself isn't necessarily sent out to our partner agencies, but certainly they would all have access, like given the fact it's a public document. But we could share the report. Obviously, the business plan itself is of course sent to the ministry, but the report would be it would be available to be accessed publicly.
I would encourage you to share it with any of our partnering agencies so that they have it on. I mean, it's digital, so it's not that difficult. Thank you.
Councillor Miller, go ahead, please.
Thank you, Mr. Chair. 2 questions. First question, in response to the one question Anthony said, we're maybe looking at an increase to 2,400. Just to be clear, there's no increase in staff as the numbers have gone up. Is that true?
So through the chair, the administrative funding envelope that we receive from the ministry has remained the same since 2018 as well, which means we are not looking at receiving any additional funding to hire more staff.
Okay, that makes things difficult. In the report, it says it's tougher to support service users because of, and then you laid out three reasons: case complexity is increasing, increased cost of living, and then an inability to receive services in a timely, coordinated, collaborative way. And I suspect no increase in staff doesn't help as well. And in the report, it says these issues have been brought up with the ministry, MCCS, and the association, OMSSA. My question is, are you getting any results with any of those 2 organizations? And another question associated with that is there anything that you see that we as the Social Services Committee, as 2 municipalities, should be doing more of?
Excellent questions. Through the chair, as mentioned, we do have regular meetings with our program supervisor, and actually these meetings do occur on a monthly basis. While the program supervisor is sympathetic and understands the pressures and the difficulties faced by the service users and of course the local offices, there is no indication at this point that we will be receiving additional funding to be able to put into frontline service, or that there will be any rate increases.
Sorry, the supplemental question to that was, do you see, is there anything that you see the Social Services Committee or our two municipalities could be doing? Whether we, there's an ask for more money, or there's, and I know it's provincial funded, or meetings with ministers. Is there anything that you see us helping out?
This kind of enters the political round, so I'll take this off acting directors. So Director Labatt is saying he's meeting with the program supervisor, which is his level. We made, this is now catching some traction. So we would like to maybe possibly meet with the regional director of MCCSS, and as well as possibly more senior officials, to let them know the stress that's putting on our local staff, because the caseload is getting larger and larger, and as well as our for our staff to manage. So we'll probably have that discussion, as well as possible meetings with the minister if it elevates. OMSA is a bit of a lobbying body for the municipalities, but it also it struggles at times too, and this also be put on the OBCM, Ontario Big City Mayor's agenda as well.
Okay, and through you, Mr. Chair. I think if there's a role, if you need more help with this, I think we could certainly help push it, because the fact that the caseload's gone up, but no funding has gone up since 2018. Like, it's ridiculous, right? And if you look at something like the optometrist, I mean, they had to fight for years and years just to get an increase. So I think we got a battle on our hands, but I think we should be all involved. So,
Councillor, thank you. I don't see anybody in the queue right now. So let me ask you, so the federal government relieved our caseload by introducing their emergency benefits. Is that what I read in the report?
Yes, that's correct. The caseload did decrease significantly when those when the federal benefits were introduced. However, when they ended in fall 2020, we began to see our caseload increase significantly.
Weren't those benefits intended to help out folks who had lost employment during the pandemic?
To you, Mr. Chair, yes.
So they considered OW benefits to be employment?
Through the chair, I don't have a good answer for that one.
I guess that would be what one would extrapolate. Thank you. So we're picking up now the spill off for the decline in the ability of folks to enjoy those higher degree of government benefits. And what's going to soar, we dropped by 29%. It's going to increase by more than that, if I read the report correctly, right?
Yes, that's correct. We'll likely see an increase of up to approximately 36%, which would bring us up around 2,300 cases, if not higher, by 2024.
And the business plan submission is an annual event that we do. Does our business plan change radically year to year?
To you, Mr. Chair, there are changes, but they're not necessarily significant. The business planning process was interrupted due to the pandemic. So while it was an annual process, this committee would have seen the last service plan or business plan back in fall 2021. Since then, there has been significant changes for us because we are an early adopter site for the employment services transformation. But historically, year to year, there isn't much change in terms of what the expectations are with that business plan, basically providing an outline of the service provision, but also providing details around the budget.
Thank you very much. We will go to the question, Emma.
Thank you. All those in favor of item 6.1, Ontario Works Business Plan? Thank you. That item carried unanimously.
On to item 6.2, Councillor Carpenter, that's your baby.
Thank you. Reading the report on page 4, it talks about the funding is for agreements that are ending, service agreements, i.e. mortgages. So is this our housing? Is this community housing? Could you explain this in a little more detail?
Good morning, Mary Musson, Director of Housing and Homelessness Services, through the chair. Yes, so service agreements that are ending for the end of mortgage and end of operating is specific to any of the housing development sites that were downloaded from the Housing Services Act. So this would include our local housing corporation, the Brantford municipal nonprofits, as well as the 12 local nonprofits and co-ops that have service agreements.
And do they go to market for their mortgages, or are we able to provide mortgages as a way like a debenture?
So through the chair, for the local housing corporation and Brantford Brant municipal nonprofit, they would be negotiating their mortgages through the ministry, and the nonprofits, and for the co-ops, they would be responsible for negotiating their mortgages.
So they would go to the private sector, the banks, institutions, and pay the current increased mortgage rates.
Through the chair, they could negotiate their mortgages that way. Yes.
They could, or they do.
Through the chair, I don't know for sure if all of them do, but I would say that yes.
Okay, so that means the interest rates, how long they expect interest rates to be up? That means that's an impact on the whole cost of all the operation for all housing. Has a significant negative impact on housing and the higher interest rates.
Through the chair, yes, that is correct.
And so the extra funding just covers that.
Through the chair. So the extra funding, those service agreements would be for anyone who is exiting from a service agreement. So we have 2 or 3 local housing providers who will be exiting from service agreements with the city of Brantford as the service manager. And we would be looking at entering into new 10-year agreements as per the legislation changes from 2022 using this funding.
And financially, what does those legislative changes in that agreement mean to them?
Through the chair, can you specify a little bit more?
Well, you're saying they're going to negotiate with us new 10-year agreements. What does that financially mean to them? Do we know what that means?
Through the chair, no, staff are currently investigating the financial costs as well as all the other ramifications of these agreements. And there is a report that is queued up to come in Q3 of 2023 to explain all of that.
And you said the new provincial regulations. Do the provincial regulations make it more difficult or more expensive because the regulations have changed?
Through the chair. So with the legislative changes from 2022, any nonprofit or co-op who is looking to exit from the service manager will have to show financial viability. And so it will be more difficult for housing providers to exit from the service manager's jurisdiction, but this is quite beneficial because we can support them financially and we will retain more affordable housing within our system.
Yeah, so it's better if they keep their agreement with us.
Absolutely,
Right.
it is.
Thank you.
Councillor, thank you. I don't see any other requests to speak, so Emma will go to the vote, please.
Thank you. All those in favor of item 6.2? Thank you. That item carried unanimously.
Councillor Carpenter, 6.3.
Doesn't want to come up like it's supposed to. Technology. We're having difficulty here. Okay. Shelter diversion support. What does that mean?
Through the chair, shelter diversion support means that whenever an individual or a household enters the system looking for emergency sheltering, the very first step is to determine if there's any safe alternatives that the individual or household can access before they are brought into the emergency shelter system. So this would be exploring if they have any family or friends that would be able to support them even temporarily with shelter in an effort to make sure that they're connected with their support networks instead of having to bring them into the emergency sheltering system.
Okay, so and then any staff or any resident that's receiving a rent supplement that's moved over to the new funding stream, would that be seamless?
Through the chair, yes.
And is there an end time to that, or what is there's no financial difference whatsoever in how that program works now? Well, the program it is, but because it's a different name, but does it reduce the fees? Is there reduction here?
Through the chair, no, it would be completely seamless. So the impacted household should not even realize that their funding is changing from one stream to the other.
And your report says it's increasing the number of households that can be supported through rent supplements. How are people made aware that rent supplements are even exist?
Through the chair, on our Brantford.ca website, the rent supplement program is explained, and there is a link that shows how private landlords who are interested in entering into agreements with the city to provide a rent supplement unit can access, and it also speaks to tenants who are looking to access a rent supplement unit, how they can apply for a rent supplement.
Yeah, rent supplement means taxpayers' dollars flows through from the tenant into the landlord, who then profits. But can you tell me, have we tracked the increase? Because we've seen the increase in housing. You know, even the first report that said it was $1,000 a month or $1,100 a month for a rental unit. That actually one bedroom is up $1,300 if you can find it at that rate. So, are we tracking the increase in rent numbers that have gone up by landlords, and then subsidized by us through the rent supplement program? Have we tracked that over over a 5-year span to find out what that increase has been, and rationalize that with how much money we've received in increase from the province for this, or the feds?
So through the chair, with our service agreements with private landlords, we do track the rent that they charge, and they have to be within an affordable limit. That data that you're asking for, we can.
No, what I'm asking for is the overall amount that we do. I mean, because what happens is that you get rental evictions and all kinds of other things, and then that same tenant's looking for another place and then applies for the rent supplement again. But if just the overall rent supplement bubble has a portion of number of individuals in the program, how that's tracked over the last 5 years, for example, to see how rents have been, because we all know rents have been increasing in the last 5 years dramatically. So the rent supplement must be increasing dramatically as well, I would assume. And especially unless they, when they have to move out, or we have to find new people are looking for rent supplement. I'd like to see us track that in relationship to how much revenue we're receiving, so we can make an argument to the province or the feds that it's not funded enough.
Through the chair, yes. So with the rent supplement program, the rent that would be charged by a landlord has to stay within a certain limit. So we would not agree to subsidizing rent supplements over a certain limit. So the average rent supplement right now is $400 to $500 per month, and we would not look at increasing the supplement for any private landlords. So one of the requirements of a private landlord looking to enter into a rent supplement agreement with the city is to make sure that their rent is affordable. So a private landlord charging $2,000 a month rent for a 1-bedroom would not qualify for the rent supplement program.
So we use the affordable housing guideline for that?
Yes, we do.
Okay, that's good to know. Thank you.
Councillor Celeste, go ahead, please.
Thank you, Mr. Chair. It indicates that we've got a request for proposals for warming and cooling centers for homeless folks. Does that include in the summertime seniors who are suffering in the heat, that don't have air conditioning of any type? Are those folks also included in these cooling and warming centers? Or is that strictly homeless people?
So through the chair, yes, anyone. So for the request for proposal where we're looking at warming and cooling centers, anyone would be welcome to access that.
Okay, because this is done, it says because of the homeless situation, and I'm just wondering, is there a parallel system going on that would handle the senior folks? Or do these folks just commingle?
Through the chair, no, there wouldn't be a parallel system for seniors. There is one system that would support anyone regardless of age or gender.
So
Or
if I can,
financial situation?
if I can just jump in, just to answer well, Councillor Celeste, we also sometimes open up in heat situations. We've opened up our rec centers in the past with Wallace and Water, and with I'll be honest with you, we've done it in the last couple of summers, and we've had little to any uptake when we've advertised to the public, but we have opened up our various rec centers out in the communities.
Okay, thank you.
Councillor, thank you. I don't, Councillor, let me see, anybody in first time speaker? Councillor Samuel? Did you have your hand up? No? Okay. Councillor Carpenter, go ahead. Number 2.
Yeah, I'd like to address the request for proposals. How will that, is that for everything, the shelter, all of it is request for proposals? For all the services?
Through the chair, the request for proposal will be addressing our emergency sheltering system.
Yes.
And so under report 6.4, we would outline everything that we are looking for. So that would be our entire system, which includes the emergency sheltering. And we would be looking at enhancing the emergency sheltering system. So with intense case management, diversion support, hygiene stations, etc.
Okay, and part of the emergency shelter program support, I think we only get one bidder. Is there more than one bidder available out there?
Through the chair, what we are hoping to do is establish a framework, and there can be multiple bidders who could be submitting multiple proposals for various components of the system.
Is it something that the committee should consider doing themselves?
Through the chair, that is something that could be considered.
Because the current location where we have it, I mean, what we found is that the whole neighborhoods have been destroyed as a result of that shelter. Like what's going on in the streets around that shelter and in our downtown core have been very problematic. And how are we addressing those things as far when we do the proposal as well? It'll be addressed in that matter or at all?
Through the chair, there will be oversight of all of the shelter providers in the shelter system. So there will be regular audits and there will be contractual obligations. And we are looking at introducing a peer support model as well as a good neighbor policy within the sheltering system.
Will there be a report coming forward on the current shelter system that would have to be rebid about how the issues and concerns we've had over the last contract?
Good morning, Aaron Wallace, Acting General Manager for Community Services. So the report in front of committee today does aggregate all the information we currently have from the shelter system and some of our recommendations to improve. And so we do acknowledge as staff that there's more we can put into a new system around, as a director said, there's things that work well in other communities in terms of peer support in the adjoining area of the shelter, making sure there's adequate funding for security, if that's an answer to some of those challenges. And as our director said, something akin to a good neighbor policy around, as you respond to this RFP, we do want to hear from the prospective proponent about how you are going to support the adjoining neighborhood. So there is no planned report to bring back besides this housing stability report you see here, but staff do acknowledge, as always, we can improve these processes and improve the system. And that's why we want to issue that RFP, get it out on the street and see what ideas people have.
Okay, thank you.
I don't see any other speakers. So let me ask, should we be specifying locations where shelter providers would be permitted to locate?
So through the chair, the RFP won't ask proponents to propose something within a specific geographical area. So we won't set out those parameters. We want to hear proposals from providers that may have different locations in mind. They may be using existing properties and expanding out on that. So we're not going to put geographical limitations around the RFP process, but certainly they would have to come in line with any zoning or licensing restrictions that the city or other levels of government would have.
So are we going to be speaking to the desirability of rezoning?
Through the chair, that hasn't been in scope, but with this discussion, but we'll take that as guidance from this committee and we'll go back to our colleagues in planning and see what some of those opportunities might be.
When one looks at the availability of vacant structures, quite often some of those are within residential neighborhoods. So we may want to address that so we don't end up with a successful proponent wishing to locate where they're going to be nothing but a nuisance.
Through the chair, let us take that away as guidance, certainly.
Yeah. Councillor Samuel, you have the floor. Go ahead.
Thank you. I guess a lot of the questions that I already had intended to ask about oversight after the RFP, that's already been answered. So I'm glad to hear about that. But I did want to just, and I think it fits here, rather I was going to wait to 6.4, but I just wanted to commend staff on this very extensive report, and that I'm really glad that we're looking at the individual's circumstances and their needs, as well as having more options for children and families, and increased transitional housing options, as well as getting people into homes, more permanent homes faster. And I'm really glad to see the good neighbor policy type proponent in this, just to make sure that we are taking care of our neighborhoods. So I just wanted to commend you on this report. Thank you.
Councillor, thank you. And welcome, Mayor Bailey. Good to see you. Glad you could be with us this morning. I don't see any other requests to speak. So Emma, if you could take us to the question, please.
Thank you. So all those in favor of item 6.3, homelessness prevention program funding. Thank you. And that also carried unanimously.
And now it's over to Councillor Samwell to lead us off on 6.4.
So I actually had all my questions answered in 6.3 or in the other one now. So I have nothing for 6.4. Thank you.
Well, that's a darn shame. Any other speakers? Councillor Miller.
Thank you, Mr. Chair. I think a simple question. The cold weather alert is issued at -15 Celsius ambient temperatures. And I'm asking because I seen in the news some other jurisdictions are pushing to raise that. To me, well, I guess -15 is very cold. I find today at 4 degrees C quite cold. So that -15, is that a municipal directive or is that a provincial directive? Where does that -15 come from?
Through the chair. So the -15 is an Environment Canada threshold. So what happens is when the temperature is going to reach that, or that's projected to, Environment Canada issues a warning. Locally, the public health units communicate that. So we do use that as our trigger mechanism, that this is deep cold. And so that allows us within the policy to open up additional beds if needed, triggers additional motel rooms if that's something that we need to get those folks inside. So long answer to a short question, it comes from Environment Canada.
So just a follow-up question. And we talked about it in 6.3, but you said part of the solution is a dedicated warming/cooling center. Would that dedicated warming center, would that only be open when it got down to -15, when a cold weather alert was issued?
So through the chair, no, what's being contemplated, and we do want to hear proposals, is a warming center that would be open likely seasonally. So appreciating that as committee has mentioned, that -2 is cold as well. So the current policy does trigger additional resources in that deep cold as per Environment Canada. This new version, this new shelter proposal that we're looking to get would be more of a seasonal warming shelter so that in those milder but still colder temperatures, there'd be some access there as well.
Okay, that makes sense. And I appreciate when talk on the previous 6.3 was brought up about, locating them and you want to be good neighbors and zoning and all that. But would you not want to locate them, I guess, closer to where the demand would be? Is that part of the intention when you're looking at where they be located? Because I got to assume that there's certain areas where they'd be more readily accessible than versus, say, other areas.
Through the chair, the transit access and access to emergency sheltering and warming and cooling centers is very important. So within the system, we will be looking at different transportation options as well, so that folks in the county who may be experiencing homelessness will have a seamless entry point to access services as well. So that is a factor that we are looking at. However, as we have previously mentioned, we cannot limit or dictate where the services will be located.
That's a great answer. Thank you. Thank you, Mr. Chair.
Emma, if you could take us to the vote, please.
Thank you. All those in favor of item 6.4, housing stability update? Thank you. That item carried unanimously.
Well, we have no resolutions. We have no notices of motion. So that concludes our business today. Thank you, everybody, for attending. And we're going to adjourn and recess for a few minutes. Our county folks are not required for the Brantford meeting today, as we have none. So we'll resume shortly with the Brantford housing agenda item.
Thank you.
Welcome back, folks. We'll get started now with the Brantford Municipal Nonprofit Housing Corporation Board of Directors meeting. Could I get a mover and a seconder for everything before us? Councillor Samuel, thank you. And Councillor Sless, thank you. Anything to be separated for discussion, folks? Councillor Carpenter? No. We'll go to the question then, Emma. Oh, Councillor Sless, sorry. Go ahead, please.
Yeah, I just had a question on the statements.
Go ahead, John, you have the floor.
Okay, it's just on page 13. It says our rental income from market tenants was budgeted for 460,000, but we only collected 180,000. I just wondered how that could be. We know what the rents are. Were people not paying their rent, or why is that such a discrepancy?
Good morning, Anna Hietala, Senior Financial Analyst of the Finance Department. The budget of the 460,000 includes both the market and RGI rent, actually, but for the financial statements, we separate the two. So we received 180,000 for the market rent, and the RGI rent was 281,000. So the actuals for both were 462,000, and our budget was 460.
Okay, so we listed as market rent, but it also includes other revenue then. Is that the idea?
That's right.
Okay, thank you.
See nothing else. We'll go to the vote. Em.
Thank you. So we're voting on item 4.1 and the minutes. All those in favor? Thank you. That carried.
And we are absent any resolutions, no notices of motion. So that concludes our business today. Thank you, everybody. We'll see you next month.